All right, we're going to call this meeting to order. I'd like to welcome everybody who is here. We really appreciate everyone in the audience. We're going to go ahead and start with item A. It's an amended agenda. So, Tony, are you going to take letter A, the purchase and sale agreement lease?
This would execute the agreement we've chatted about for months relative to Schaefer's, the acquisition of the property adjacent to the Arkansas River. Terms and conditions haven't changed since we last spoke, and this will then trigger the closing. We're looking at a closing in early March. They're actually interested in a closing sooner than that. If we can accommodate that, we will, but it's on a pretty accelerated rate right now. But we appreciate their cooperation and reasonableness, and this hopefully triggers a new day on the Arkansas River corridor with this acquisition. It's a very critical piece of property.
So is there anything that we need to discuss today about it, or?
No, the price, the terms have not changed since our last discussion.
Okay, any
Unless
comments?
you have any questions about
There are
it.
questions from council?
I'm trying to find my paperwork.
Oh, okay.
When did we get this, last night?
Monday night.
With a different agenda?
Monday night, it was separate.
Yeah, it should have been on the Monday agenda, but Ryan was working on this, and he was a little busy last week.
Yeah, I just put it in your stack of papers on Monday.
So we'll take care of it now.
Okay. Jim, do you want to have a couple minutes to collect your papers, or we could always come back with more questions too?
Well, nothing's changed. No, I just want documents.
Yeah, nothing's changed.
Okay.
Trying to find it.
All right. Excellent. Then we also want to welcome Police Chief Harvey and Brian Turner and welcome you today. I know this is kind of a really big, we've had so many exciting things happening in Canyon City, so many positive things and excitement for the future of where we're going, but that also means we have some more somber issues that we also have to deal right before it gets overboard, and that is our heroin and homelessness problems. And we welcome both of you here today to address us about that.
Thank you very much, Mayor Pro Tem Smith. And so I think what I'd really like to do with this is just kind of throw out some high-view circumstances that are happening both regionally, nationally, and then also in Canyon City. And then what we're talking about as a solution and some of the grant funding sources that we have that actually are going to help us build not only a response protocol within the city of Canyon City, but also a support organization group. And I'll tell you a little bit more about that as we kind of go through this process. But to wrap our hands around this is not simply a police department issue. And so my colleague here, Brian Turner with Solvista Health, St. Thomas More, the county public health and Department of Human Services, there are a number of different governmental partners in addition to faith-based organizations as well as private recovery organizations that help us really respond to this issue. And so this is supposed to be more or less a general snapshot of what we're seeing here locally based on enforcement statistics, and then a discussion about what that means at least to us and how we're responding to the opioid issue. So the scope of the issue really nationally is that, and this is no surprise to anyone, that nationally the number of opioid deaths are growing. And there's a couple of different ways that that's actually come to be. So some of that is from illicit drug use. Some of the illicit drug use has actually been driven by prescription opioids that are prescribed for legitimate reasons, for pain, back surgeries. Fentanyl that everybody's familiar with is actually a prescribed substance that is used for pain. And actually, the opioids and methamphetamines are surpassing cocaine and other types of illicit drugs, but that's on a national scale. That's not what we're seeing here locally. Here locally, we're actually seeing opioids reducing in use as far as illicit substances, and methamphetamines are actually on the rise. Some of the leveling off that's happened over the last couple of years have been in response to public safety organizations nationally having Narcan on their belts, having it available in public places, and partnering with behavioral health and medical providers to be able to respond to the opioid epidemic. I know that the legislature is actually looking at safe injection sites or needle exchanges and some data around that of whether or not that's a viable issue. And nationally, there is some interest around that, but the data that I'm finding is pretty much out of Canada, and that data out of Canada says that safe injection sites help reduce the number of opioid-related deaths, but there really aren't no studies yet on how that impact affects addiction or whether or not that population grows. And there are some sites within the United States, Boston being one of them, that what they saw there was a reduction in opioid deaths, but a rise in people moving to the area, much like marijuana tourism. People moved to the area to be near those safe injection sites that had opioid issues. And so there was obviously some social concerns that came along with that for caring for that vulnerable population. So looking at opioids historically from 1999 to present, you can see here that really prescribed opioids started off in the early 90s as being, early to late 90s, as being the predominant method for illicit opioid substance use. That's the oxycodones, the oxycontins. Those would be prescribed typically by a licensed physician to a person with a medical need for those substances. Those pills might not be completely used by the individual, and so any that were left over were then transferred to the black market and sold on a per pill basis. There were actually pharmacies that started to get broken into in order to be able to supply this demand. And with greater controls and more security around prescription opioids, synthetic opioids like fentanyl, tramadol, and others that are manufactured lawfully, some that are illicitly manufactured, have taken over the opioid substance crisis. Heroin, as you know, everybody thinks about opioids as heroin in the illicit drug market. That's not really, even today, smack or black tar heroin, stuff that's made in backroom labs really isn't the forefront of the opioid crisis that we're seeing across the country. So there again, it goes back to safe injection sites. That depends on whether the method of delivery in your location is somebody actually injecting an illicit substance or whether they're orally taking these medications. So there's a much bigger question there about what other medical means we could implement to affect the opioid crisis. So in Colorado, and you can see there on the graph on the left, we are doing better than the national average. So opioid-related deaths in Colorado, that's per 100,000 persons. Nationally, that's 13.3 per 100,000. In Colorado, we are at an all-time high of 9.5 deaths per 100,000. But locally here, we're actually getting a better handle on that, and I'll show you that in just a minute. So this is a graph from the Colorado Department of Public Health and Environment about opioid-related deaths, and you can see kind of the transition there in the past. Now, I didn't include the data for all of the different counties, but obviously the darker areas, which is Pueblo, Huerfano, Los Animas, Baca, Costilla, Conejos, and Rio Grande, all in the southern Colorado area. Custer and Fremont, not as densely, yeah, it's really hard to see there, so I apologize about that. But Fremont County is right here. Pueblo right here, and Huerfano County right here. And so these darker areas are the ones with the highest statistical numbers of deaths per 100,000 residents in the state of Colorado. And just to kind of give you a comparison, you know, obviously Yuma, which you can see, and Cheyenne and Mineral County, they have very few, if any, deaths. But Denver County and Pueblo County having higher concentrations, they had 11 deaths in 2014. We had 9. So how that relates to us locally here is the number of drug cases that we're arresting folks for and actually getting reports of. In 2017, we had 106 drug-related cases. 60 of those also included paraphernalia, which some were needles, some were not. Only a third of those were opioid cases in 2017. And so one of the things I kind of want to point out with this is that looking at national trends and acting locally has helped us impact this. Again, direct causation is hard to say without efficacy studies to say whether or not our improvements in narcotics enforcement and improved relationships with behavioral health and mental health organizations has actually impacted that, or whether that's just a change in cycle. I mean, that's only 4 cases really down, but our total drug cases, meaning the number of cases that we are making, are higher, so we've arrested more folks and charged more folks, but our opioid seizures are going down. And so if you look at the percentage there, roughly 30% in 2017 as opposed to 23.5% or almost 23.25% in 2018. And I really attribute that to a couple of different things. That's the awareness of the community. And again, wrapping this around, this is a communal issue. It's not simply a law enforcement issue. So this kind of segues into the discussion about what are we doing as an organization. And we are looking at a bifurcated approach. So the law enforcement initiative, we are expanding our narcotics enforcement team to add additional people on that team to address the availability of substances. And that's the primary focus of them, is not necessarily to address those suffering from an addiction, but to create additional seizures of people who are actually profiting from the illegal drug trade, remove the availability or quantity of substances available out on the street for purchase from folks who are suffering from addiction. And on top of that, we're expanding the canine unit. Some of that has been done with donations, and some of that is donations that have been made over the last several years. But we actually had a canine, a Labrador canine that has been donated that is already trained in narcotic sniffing that we're hopeful to get out on the streets in February once we get a handler identified, and expanding to a 3rd dog. So that would give us 3 dogs to help detect narcotics in our city. And the primary method with this is deterrence as well as enforcement. So if we have the best canine, a large narcotics group, people pay attention to that. And so they're less likely to come to Canyon City where they're going to get caught or have a higher likelihood of getting caught either transporting or selling drugs. And so that's really the methodology behind that. This co-response unit, which is the 3rd law enforcement initiative.
Please, Chief Harvey, we have a
ma'am.
question really quick, if you don't mind.
Can I ask a question now about your chart? Or you want me
Yes,
to wait?
You can ask now, sir.
That chart you had on the number of deaths and the deaths per 1,000, a couple slides back. Then in 2000, looks like 10, there was at least a noticeable dip in all the figures. Is there any, back another, there. Is there any known reasoning for those dips that are occurring in around 2010?
Recession.
So right around that time frame is where prescription of opioid substances really became a focus in the medical community. Now, I'm only saying that based on the Center for Disease Control surveillance report, so I don't have a direct correlation. But what they talk about in that report is that between, and it's captioned here, 2009 and 2012, the awareness that prescription opioids were the driving force behind the opioid epidemic transitioned into some stricter controls for the ability to be able to prescribe. The Drug Enforcement Administration looked more heavily at doctors who are liberally prescribing opioids for in large quantities, maybe not medically necessary, but in other words, they might give them a prescription for an opioid and then give them 3 refills without a direct correlation to say, this is a continuing medical issue for which you need 3 refills. So that's a supposition on my part, but based on the surveillance report by the CDC, it seems to correlate with that kind of same time frame. And then if you look at this graph, the 2010 was really when we had that rise. And you can see there, synthetic opioids really started to take off. And right around 2011, 2012 is when prescribed opioids kind of took a little bit of a nosedive there too. So that's a supposition on my part without direct evidence stating that that's the reason. So that's my best guess, sir.
Thank you.
Actually, my colleague might have something. Do you want anything to add, Brian?
I was only going to say the only other conclusion I would come to is that it's an anomaly in the data
I
collection
think
practice.
that's, the way the graphing is, it's,
If
would
you look at the
suggest
trend line instead of the actual,
Yeah,
if you were
something's
to
wrong.
put the trend over it, it would still be heading in the same trajectory,
Right.
more or less.
And so that third piece is a co-response unit. And the co-response unit is kind of a compilation of best practice models that address 3 different issues which we see present in Canyon City. And so that's narcotics addiction, mental health, injustice involvement, and homelessness issues. And so what we are seeing anyway with our local data is that those 3 things tend to cross over. So we have about 30% of our homeless population has undiagnosed mental health conditions. Around the same percentage, 26% roughly has some sort of recognized addiction. And, you know, clearly there's some self-sufficiency issues there that, or other circumstances beyond their control that have led to homelessness. So what we're trying to do here is to correlate the 3 of those so that the individual from the police department that will be responsible to respond to these issues looks at it holistically instead of saying, okay, the mental health issue needs to be addressed, but the person also has justice involvement or a pending court case in the wellness treatment court for possession of opioids in, 6 months ago. So it's a way to look at this more holistically and communicate that to not only our partners like Solvista, but then also to the wellness treatment court to say, okay, this is kind of the bigger, broader picture. So how do we get this person back to self-sufficiency and make them whole, addressing the undiagnosed mental health condition, addressing the addiction issue, and providing job training or whatever the other issues are surrounding the homelessness issue. And the mindset with that is based on a model that comes out of Seattle Police Department that triages individuals that officers run into with different types of justice involvement. For example, if we had somebody at Loaf and Jug that was screaming on the sidewalk, causing a disturbance, and the officer arrives and recognizes there's an undiagnosed mental condition there, the person also is homeless, hasn't eaten in a few days, and then also is in possession of some sort of narcotic, then that individual will be a one-stop shop to help from that initial contact all the way through whatever law enforcement case they've got, access to treatment to address the undiagnosed mental health condition and the addiction, and then obviously have the wellness court put some things in place that encourage the person to complete whatever treatment is necessary to address those different issues. And so on the other side of that, that's what it looks like from the police agency side. The co-response unit is not an autonomous unit, and so what we are looking at creating is something called a crisis intervention committee. And that, again, is based on the Seattle PD model that brings in different stakeholders from around the community, private organizations that address addiction, the National Alliance for Mental Illness, behavioral health providers, law enforcement, private citizens who have suffered with addiction themselves, to really give a complete picture of how that policy can be successful in helping individuals that are encountering these circumstances get beyond them. Is there any questions about anything I've said thus far?
Go ahead.
I've meant to ask this before because we have recognized your department in saving 3 lives with Narcan. I'm wondering if there is some kind of or any kind of follow-up with the folks that have been given that Narcan, and are they sent to treatment right away? Are they what happens to them afterwards?
That's a really good question. So our policy is whenever Narcan is administered, we contact medical providers so an ambulance is called to be able to come and continue that care. Whether that person actually has access to treatment afterwards is completely dependent upon them, whether or not there's criminal charges that are levied against them, so we can mandate compliance with treatment, so that it's a broader picture. But as it stands right now, that's one of the areas that I'm hoping that this co-response
Okay.
will really provide proactive case management. So in other words, somebody overdoses, we save them on Narcan, and actually, we just had another one last week. We've totaled 5 in the last 3 years, 5 saves with Narcan just in the police department in Canyon City. And that would immediately put that person on the radar for the co-response police officer and clinician from Solvista to go back out and do follow-up case management with this individual to make sure that their needs are getting met. I can't say 100% at this point that all 5 of those folks have received access to care or not at this point, because we haven't done that case management as a group.
Well, I think that, Narcan is definitely a great thing to have, but if they continue to overdose and follow down that same path, we're not following up with them to make sure that they're leading a clean life, then what are we doing? And then also, well, no, I'm not going to ask this right now. I'm done.
Okay,
Thank you.
Mayor?
I caught, you said something about a co-response court, a wellness treatment court. Is that a district? Is there something that exists? And
Yes.
is it
Yes, sir, it exists currently, and it's actually at the county level.
it's district? Or, I guess that's the same thing.
Yeah, yes, sir.
What role then, so we treat them with Narcan, as Ms. Gonzalez said, then they go to a treatment court, or how do they get into that? Is that your referral? They arrested for possession, and they go there?
Yes, sir. So if they have a substance on them, it's not simply in their bloodstream. So if somebody overdoses, let's say, and we issue or administer Narcan, if that person doesn't have any additional substances or paraphernalia on them, currently we're not charging them with possession, even though it's actually in their bloodstream. It's difficult to prove, and so the district attorney has issues being able to show possession with the overdose, so that person likely would not be referred to the wellness treatment court. Under this philosophy, what would happen with that individual is that even if they're not referred to the wellness treatment court, the co-response unit would then follow back up with that individual, in the following week or within the next 3 or 4 days to see whether or not they've actually recovered, whether they're in possession of additional things that might get them justice involvement, or whether they're simply willing to go on their own to enter into some sort of a treatment, because the statistics that I'm familiar with, and I would encourage my colleague to correct me if there's something more recent, but 1 in 10 people who has been saved by Narcan will die within the following year from an opioid overdose. And so that's really what we're trying to address there, is that follow-up piece that kind of is not happening currently.
Okay, thank you.
Are there any other questions from council? Do we have?
I do.
Oh, sorry, Frank, go ahead.
And I appreciate everything that's being done, but the only thing that I look at as this is, and I'm not against helping people out, we need to look at doing that, but if we've got a crisis in this town with opioid overdoses and this and all that, I look at it where it could be a big drain and strain on our police department. And now the focus is going to be so much involved in that we're going to lose a little bit of focus on the other things that help make the city a safe place. And I would just, I can't tell you how to run the department. That's your job, okay? And I wouldn't even think of it. But I'm just hoping that you'll look at it. I don't want to overtax our officers with stuff like this, and then it causes problems with the rest of the things that we need to keep this, this town safe. And you guys are doing a good job, so that's my only caution.
Thank you very much for that. And so I'm definitely sensitive to that, and we're trying to more focus the department in specialized areas to address, like traffic enforcement is clearly a need that we need to have a more concerted effort in. And so this is very similar to that, in that we haven't asked for additional funds from the city or additional taxpayer revenues. The state has provided, and the project work plan that you all have a copy of, that project work plan is an application that was recently approved by the Office of Behavioral Health that over the next 2 years will give us $550,000, up to $550,000 if we have that financial need. Currently, what I've requested was one full-time police officer and a full-time behavioral health clinician from Solvista, so that the average police officer, when they get a 911 call, they're not doing the proactive case management. And not only that, so it doesn't take away from our ability to be able to respond to those emergency incidents and patrol and shift our focus. It also takes a very highly skilled and specialized person to understand this and understand this human behavior and be able to effectively do what I'm asking them to do, which is really case management on the behavioral health side rather than law enforcement.
So, Police Chief, from the research that I've done too, they say that if you have that clinician and that social work and case management, that actually it ends up freeing the police officer's time, because some of these cases, they demand a lot of supervision, a lot of time, a lot of oversight, and if the clinician can take care of those needs and settle down the problems that they're creating, that the police officer is freed up to do what he's supposed to do and take care of the police force.
That's
Is that right?
absolutely correct. And Colorado Springs Police Department is a very good example of that. Colorado Springs PD has actually kept statistics when they started their co-response model to show a baseline, and on high utilizers especially. And what I mean by high utilizer is, you know, that's the person that the police officer knows that has a psychotic episode this week because they have induced some opioid or some other drug and it exacerbates a mental health condition. Next week, they're homeless and breaking into a car, and then after that, they're causing a disturbance or stealing from a local store. That's what we mean by high utilizer. And Colorado Springs reduced calls in that population by 60%. So it definitely will have an impact on our overall calls for service.
And have we already hired the extra officer and clinician that we need for this state grant?
So we're actually in the process of that. Mr. Turner and myself were talking about that briefly just prior to. I have a person that I think is going to be a good fit for that currently works within the department, and then that person would take over this role, and I would replace that person with a new hire. But I think we're still in the process for looking for the clinician.
Yeah, we're finalizing our interviews right now for that clinician to get in and work on the team.
Excellent. And I thought it might be prudent to also mention, we've talked about you've saved 5 lives with Narcan, and there's also some harm reduction laws too that are important to highlight. So let's say if there's 2 people together and one of them is overdosing on heroin, if they call 911 and they stay with that person to help them stay alive and be safe until the police get there, that person who called 911 won't be charged with criminal activity because they're there to save a life. There's other harm reduction things too, like if you want, and I'm curious if this is a current law already, if you needed to pat somebody down to check for drug paraphernalia, and you ask them ahead of time if they have any needles or sharps on their body, and if they tell you yes, then they won't be charged for that either, because it's a protection to the police officer as well, so they don't get stabbed by needles. Is that true?
Yes, it is.
Have you found very many opportunities where that came into place for harm reduction in Canyon City?
Not locally in Canyon City, no.
Are there other harm reduction laws that are in place now to protect our officers and those and lives?
I think those really encapsulate at least my understanding of it, but there are some new bills that are looking at being rolled out this year that are obviously aimed at reducing addiction and removing the availability of substances, which is our philosophy here as well. It's not punishing the person with an addiction. You know, if you want to look at Harvard Medical School and some of the articles that are out there, the big push is really around wrapping care around individuals and changing the perception that if an individual needed diabetic insulin, and this is specifically from the article I'm referencing, that if we created safe injection sites to help a person with insulin, get the shot that they needed, there wouldn't be as much discussion around it. Now, the obverse side of that is that diabetes is something that is not within the control of the individual to stop that condition. So that's really the rub there. But the stigma is around saying, okay, this is something, we get a football person that has a injury to the lower back and they've had surgery, they got prescribed fentanyl. And I've been to a number of deaths in my career where a person developed an opioid addiction based on some sort of surgery that's commonplace. The person was, a productive member of society prior to. They get hooked on these opioids. They can no longer get them legally prescribed and then look at the illicit market to be able to fulfill that physiological need. So that's really what the current philosophy, both at Harvard Medical School and in the legislature that I'm aware of, is to change the perception of how we look at addiction and then how we can respond to it. Is it really a criminal matter? I think that there's a lot of questions around that and what it relates to intent, like everything else does. And so if this is beyond the person's control, then we need to look at it from a different lens than a criminal perspective. And there's only 2 bills that I'm aware of that are being proposed right now, and they are around safe injection sites, which could have some federal challenges as well. But those are the only additional ones that I'm aware that are on the table.
I'm sure Brian Turner, go ahead.
It isn't necessarily a law, but one of the interventions of public health strategy that I don't want to get confused with the safe injection site is just a needle exchange site. And so really the focus of that not necessarily being overdose, but being how can we reduce the spread of HIV and Hep C from dirty needles, from people reusing dirty needles, from people leaving those dirty needles in our communities and somebody else stepping on them or picking them up and getting poked. So I want to make sure those are 2 very separate issues, both of which are being discussed. I think certainly needle exchange is the far less contentious one than potentially a safe injection site.
Is there a needle exchange in our area already? A needle exchange program?
No, ma'am, not that I'm aware of.
Meisner?
I'm not sure who answers this, but the clinician relative is, the grant is going to help offset the cost of the clinician or just the police officer?
Both.
The clinician works for
Solvista Health.
Solvista.
Correct.
Okay.
Well, and it does more than just pay for salaries, does it not?
It does. It pays for training, it pays for equipment, it pays for workspace and indirect costs. There's actually, because I've only budgeted $191,000, the state had said if there are additional things that you need, which we are looking at potentially having these individuals have the ability to travel to best practice models around the nation and bring that information back. There's also a court liaison that is not part of the grant that Solvista is.
Yeah, we secured another grant from the state of Colorado, and we have just hired this position. They'll be starting in the next couple of weeks, hopefully, as a court liaison. Right now, that's primarily focused on district court, but this is an individual that will be working closely with the judicial department, with city or with county attorneys, with the public defenders, with the judges themselves, on going to wellness court and the other courts that are established there and saying, if there's an individual with a behavioral health need, are they appropriate for services? Is there a different pathway we can go as far as how that person might be sentenced or a deferred sentence, that sort of thing? See if we can break that cycle of recidivism and get somebody into treatment rather than frequently back into the court system and the criminal justice system overall. I was actually at municipal court yesterday and talking about the potential for also using that position to support the municipal court needs as well.
I think it's important, too, for council to know that we are not just applying for every grant that's out there. There was a grant that came from the state that was law enforcement assisted diversion, which had no mechanism of control. If a person suffered from addiction, they were diverted out of the criminal justice system, and there was no follow-up by the criminal justice system. So if they entered into a treatment program, did not complete it, recidivated, came back out, continued causing problems, essentially that criminal charge that initiated their referral to treatment was gone. We did not apply for that because that wasn't consistent with our philosophy to make sure that people are completing treatment and getting off of the addictions that they have.
How is this grant money being used towards homelessness as well?
It's going to be directly towards the focus of addressing substance-addicted persons who are homeless and those with undiagnosed mental health conditions. And so, in a quick term, they're going to be contacting homeless populations to address the mental health and substance use, but they are also going to be a central coordination point for all services really within our city and our county. So if they run into somebody that doesn't necessarily have these two other conditions, they will still be able to refer that individual to the appropriate resource to get job training, meet their basic social needs, to help them back towards self-sufficiency. Obviously, connections with Loaves and Fishes, so they're a coordination point, really.
You had also mentioned about, I lost my train of thought. Go ahead and continue with the rest of the discussion. I'll come back to you where we're at.
Are there any other follow-up questions for myself or
Okay.
Mr. Turner?
You mentioned hepatitis C and how using needle exchange could prevent the spread of hepatitis C, and I wondered, do you have any information on the prevalence of hepatitis C in our community? I know working in the prison system, there's so many people who are prior drug users who have hep C. It is curable, but the treatment is very expensive. It's hard to attain if you're not someone of means. So do you have any information on that?
I was just looking over my shoulder to see if Emma Davis, our public health director, was in the audience. That's who would know all of those statistics. But I'll follow up with her and make sure that the council gets that information.
I'd appreciate that. Thank you.
Any other questions from council? Okay.
So I think to kind of round out the presentation, the behavioral modification initiatives, and there are a number of them that are taking place within our community. I only mentioned a couple, communities that really looks at home life and how to transition youth, that not only their attitude towards substance use, but also their home environment to make it more healthy, to choose better choices and not obviously go down the path of some sort of addiction or other bad choices. The Collaborative Management Project, which we have a number of these folks already involved with, those conversations have been happening for a while. And the two major really shifts within our community is the effort to try and get our sobering center into a licensed social detox center. And I'll turn that over to Mr. Turner to talk about more.
So a lot of the conversation so far has been about, okay, we have an intervention point, and that's great. Maybe it's Narcan and we save a life, but what happens after that? If we administer Narcan, save a life, that's critical, but if we're administering Narcan again a week later and maybe then not doing it the time after, we're not really making a major impact in the issue here. And so one of the things that we've been talking a lot about, the chief and I and other community leaders, is we need a broader continuum of the services available if we're going to tackle the opioid crisis and substance use issues in our community on a really meaningful level. And so while we have these really important pathways to services, like a co-responder unit, like different areas in the community where people can become aware of our services, we need to make sure that we've got the rest of the continuum built out. And detox, social detox, is one of those services that I think is really critically important as a part of that continuum. So a social detox model, also known as a withdrawal management unit, is a place where it doesn't require medical management for somebody to detox off of kind of acute intoxication. So we would still, in this model, be hoping for a close partnership with St. Thomas More, and that's a big part of the conversation we've been having, where if someone needs a doctor-level supervision to medically detox, we would still be able to use the emergency department, for example, for some of those services. A lot of these folks are landing in the emergency department anyway, but after somebody is medically stabilized, we have this option of doing the social detox model where they can then step down. So they open up those beds that otherwise need to be used for people in need of emergent medical care. We can put them into a social detox model where they can then stay and get to a place of stability. We're looking for longer-term treatment options also, so then we can bring in care management services, housing services, vocational services, and give somebody an actual plan for a long-term path toward recovery where they aren't back in the emergency department, back in Chief Harvey's cop cars, or back in jail, or dead. And so this is really why we want to build out this model, and what we're hoping to do is build that on an existing part of the St. Thomas More campus. We're in, again, conversations with leadership to explore if that makes sense and if indeed that facility is suitable for such a model. The state regulates these facilities, so they'll have a say in whether or not that model works, even if it is available. But if that doesn't work, Solvista is committed to finding another option. Let's find another location where we can do this so that we can interrupt that cycle of addiction and be able to then infuse and wrap around the other services that we need to hopefully keep somebody on the path towards recovery and self-sufficiency. The beauty of a social detox model is that it can be staffed with relatively few individuals. We don't need a really expensive, highly trained clinical medical model to make this work. I'm really confident that we can find the professionals to do this, and I'm also really committed to saying with our partners, let's measure the cost that we have today of treating folks in the emergency rooms and the jails and the time that our officers are spending dealing with these calls rather than out responding to other public safety needs. And then let's compare that to what it costs to run this social detox. And I am convinced, because we see this in other models in Colorado and around the country, that there will be a cost savings at the end of the day. So it costs them upfront commitment of resources, and Solvista is willing to bring resources to the table. But the benefits overall tend to multiply into a lot of other systems as well. So I'll leave it at that and entertain any questions people have specifically about that part of the continuum of services, social detox.
And Mayor?
Is there I understood there was maybe a beginning or a detox center currently?
So what we currently have is a sobering center.
Sobering,
And so
right,
we're looking at the exact same space to see if we can kind of create this step up. The sobering center is primarily used just for alcohol. And again, it's not appropriate, or it's not being utilized for anybody who needs kind of medically managed withdrawal from alcohol. So if they need Ativan to manage that, from what I understand, that's kind of one of the criteria that would make somebody ineligible for the sobering center. So we're hoping to open this up to make sure that it can be utilized for any substances, so long as it's not somebody who is in kind of any violent or aggressive behavior. That would still be handled by the police department. But it would open up kind of the door to helping more individuals, regardless of maybe their specific intoxication need at that moment. And again, if we were to do this, there would be some specific facilities licensure and regulation questions we'd have to get answered with the state if we use that same space.
My understanding was that it's cost savings to the city because our officers don't have to take what at one time was to go to Pueblo with an intoxicated person. Is that still correct?
Yes, sir, it is. And the mindset behind this involving mental health is the same thing, that there are a number of issues when somebody is suffering from a mental health issue. Often they will self-medicate with illicit substances, and so there's crossover between those sometimes. And that, once we take someone with a mental health issue, not only for us, but for the sheriff's office, the only resources really are the state hospital, who is currently backed up. So competency evaluations and all the other things that come into actually filing criminal cases and getting them to a secure facility, we don't have those resources here in our community. So it does take an officer out of our community for extended periods of time to be able to take them to where those resources are.
Okay.
One other piece on top of that is once an individual is taken to a detox in Colorado Springs or Pueblo, they tend to be off of our radar here in Canyon City. They'll end up back here ultimately, but we don't have an opportunity to intervene and get them into the continuum of services after that. So again, we just see it repeating and at great expense because now they're in another community and we don't necessarily hear from the detox in Colorado Springs, hey, we've got somebody from Canyon City coming back. How do we create a pathway to services for them? So having it locally would be a help in that sense.
Thank you.
Dolly?
Well, this was the question I was going to ask earlier, and it doesn't really align with the detox center, perhaps, but, you know, I just have this question because I've had people try to educate me on some of this stuff. And I'd kind of like to get this information from professionals. But have you seen a trend or have any research data that has proven to help an addict who's on opioids or heroin or, you know, any of that, use medical marijuana to wean themselves off of these drugs? Or do you see that as replacing one substance for another?
So I can take a shot at that first. I'm not aware of any solid body of research that has indicated that medical marijuana is an appropriate alternative. What I would somewhat redirect to is medication-assisted treatment, which does have a very robust decades worth of research around efficacy. And these are drugs like Vivitrol or Suboxone, and so these are not drugs like methadone. They don't get an individual, there's no euphoric impact at all. What it does is it interrupts the receptors, so it interrupts the high, it interrupts the addiction pathway that might be established physiologically for individuals. And when that medication is coupled with appropriate outpatient services like the ones that we provide, meeting with licensed therapists who can treat addiction, the research shows about 60% abstinence off of opioids, and that's a seriously good statistic to have. So I'm sorry to kind of redirect and take advantage of the opportunity to plug medication-assisted treatment away from the question about medical marijuana, but that is certainly an area that we're working and we're expanding right now in Canyon City and across the other 3 counties that Solvista is responsible for serving. And the research shows that should have great promise to help.
Thank you.
I'd like to weigh in on that just a little bit as well. And my experience with that is anecdotal. Again, I don't have a body of research to point to either. But the one thing that I do see when I see cases of individuals in possession of narcotics that have a hallucinogenic or some other sort of euphoric effect is that whenever they have multiple substances on them, it is about the high, not necessarily about reduction of any type of addiction. So the key there with medical marijuana would be that the CBD level should be higher than the THC obviously being the hallucinogenic substance in marijuana, period. And whether or not that has a direct effect, whether CBD is able to actually reduce some sort of physical dependence on other narcotics, I don't know. But I do know that what I see is whenever I have folks with multiple substances, it's usually someone who is deep in an addiction cycle and not somebody who is actively trying to get out of whatever substance they're addicted to.
Good point.
Meisner?
I think I've got a weird philosophy on the homeless issue, which I've shared with Councilman Smith, but are we going to track the number of contacts or clients or patients that are involved in any of your programs and identify which of those are homeless? Or is that already being done?
We do track that, and I can get you statistics on how many of our individuals we would, the demographic details on whether or not they have stable housing or not. It's one of the metrics that we're accountable to the state, the Office of Behavioral Health, to report on, and how successful we are in helping people have housing stability. Of course, we're not necessarily the entity and program. There are many that are responsible for helping to solve the housing crisis and get people stable homes. But it's something we certainly track for our clients, so I can get that information to the council as well.
How's that getting fed into the system, do you know? Those numbers?
Those numbers getting fed into the system?
The system, the homeless process that we're working with.
That'd probably be a question for Chief Harvey. I know we just did a homelessness count. And what are some of the questions on the homelessness count that was just done? That's where they go out. They know where they are. They go interview them and ask specific questions. I'm assuming some of those might include about drug use or why they're homeless, the reasons why, and what those statistics are.
So I don't have the survey in front of me, and the point in time count, which is what it's referred to, was completed on the 31st. The data, I called about it again today, but it wasn't available yet. The surveys are still being turned in by some of the collectors or surveyors, so we don't have an accurate picture of that. But really what it's supposed to do is give us an indication of what's collectively happening in our homeless population. Are there safety concerns, unreported crimes, are there addictions issues? Are there unmet medical needs? So it's really trying to give us an idea of what that demographic is. And my purpose for understanding that information is, again, how we can address those underlying social issues to help the person on the pathway back to self-sufficiency. But I hope that answers your question. It looks at a myriad of different things: unmet medical, behavioral needs, criminal justice involvement, factors that might be causal for why they are homeless in the first place. Obviously, whether or not they have children in that circumstance as well is a question. So there are a number of them, but I don't have all of the metrics in front of me.
And kind of what are you alluding to, Jim, too, is that there's only a certain percentage of our homelessness that have drug abuse issues. There's other pictures of homelessness that don't involve drug abuse.
And the other factor is that there may be the perception that we as council and the community are not doing anything relative to the homelessness. I think you have to divide that homelessness thing into different groups that have different problems and different solutions. And we could be attacking or addressing this portion of that homeless issue and really not having much communication of that we're doing something there when we talk about the homeless thing in itself, because we're doing it over here with our left hand versus our right hand. I think that's critically important that we address that segment of the homelessness because it's significant.
Yes, I've got a question. On the project work plan, I see that there's a statement there on number 3 about sharing HIPAA data, and of course that kind of makes alarm bells go off in my head a little bit, sharing and HIPAA in the same sentence. And you know, any roadblocks that you might see there are, you know, obviously beyond the authority of this council, but could you speak to us a little bit about how that might work, or what roadblocks you see, or what types of solutions are out there for that?
Yeah, so every time I see HIPAA, or on the substance use side, the appropriate regulation is a federal one, 42 CFR Part 2, alarms go off in my head as well. So we share that. The key part is that we share information that is HIPAA compliant, meaning that we only share that information that we are legally allowed to within the parameters of HIPAA and 42 CFR Part 2. Anything beyond that is really subject to releases of information, or depending on the nature of the case, if there are criminal implications, or if we have an actual duty and obligation professionally to notify criminal justice because there may be some risk of harm to self or others. And then you can talk a little bit more from the criminal justice perspective.
So having created one of these programs once before, one of the biggest issues that we ran into was, just like Councilman Meisner was talking about, is siloing of information and inability to share in continuing a treatment plan. And so HIPAA is obviously relative to health providers, CORA and CCJRA are relative to law enforcement. And so really what that item is trying to address is agreements to share information necessary in developing effective treatment plans for these folks that complies with all the privacy regulations, Colorado Criminal Justice Records Act for me, and the Colorado Open Records Act, and then obviously the Health Insurance Portability and Accountability Act for the behavioral health providers. Because it's not just going to be the two of us that are sharing information. We also will be sharing information, or hopefully receiving information, from St. Thomas More or other entities that would be restricted with what they can share. And so that's really around getting business associate agreements together to say, this is how we are going to communicate that and how we will maintain compliance with these associated laws.
Caitlin?
We're talking about the social worker position, and I wondered, my experience with social workers is that their job is really to help people find services that they might find too difficult to coordinate with on their own. And so will the social worker that you're going to hire be able to help these folks who might be homeless? And I understand Solvista is not responsible for that, but will the social worker help them find the agencies that can help them address their homelessness issues?
Yeah, I think that's the beauty of the model that we're putting together. So a licensed clinical social worker is a very high standard for clinical treatment. In our world, I think often social worker is kind of confounded with caseworker, sometimes on the social services side. So this is truly people who are delivering direct therapeutic services in a clinical setting. We also have licensed professional counselors and a number of other clinical positions. And so the point is that we have clinical expertise who can help in the moment with crisis de-escalation and getting people into appropriate services. And having it connected to the community mental health center, that then affords us access to an entire case management team, care coordination team, peer services team for people who have lived experience with mental health or substance use and are in recovery, or we also have our psychiatric program, so they have access then to medications and a higher level of care there. So this one individual plays, as Chief Harvey already mentioned, they really are the nexus point for getting people connected to the entire continuum of services that we already have available. So hopefully that answers the question, but in housing is a part of that. So then connecting with, whether it's over at the Department of Human Services, Housing Authority stuff, we have those at our disposal once we have them kind of connected to that system of care.
That was my concern, is I know, trying to bridge those gaps for people.
Yeah.
And that can be a difficult process to manage on your own.
Yeah.
Thank you.
You bet.
And let's go to Hamrick.
One further question, actually a request. I see this project work plan. It looks very impressive. And I'm fully supportive of it. Would it be possible for you on some frequency of your choosing to come back and brief us on how we're doing, what's going on, what things we maybe can do to help in this process?
I was thinking 90 days.
Absolutely. And so this really is kind of an awareness level. We were approved for the grants. I'm still in communication with the Office of Behavioral Health. We have a contract that will be coming and a funding date, and so that will be coming back before council, obviously, for signature authorization for that grant agreement. And then we can do regular updates. As we have reportable items to OBH, we can do a follow-up report to council.
What would be, you think, an appropriate time frame for our next follow-up?
Next Friday. 90 days?
I only have one question now. I mean, everything that you guys are doing, everything else and that, how important is it to have St. Thomas More involved with this program? Because I know you guys can't do it all yourself, but what's the importance of having them, kind of step up into the plate a little bit? I know you guys are talking with them now and hopefully get them in there, but should they say no? Does it hinder or slow down the process that you folks are trying to accomplish?
I've only been in Canyon City for a short time, but I have nothing but positive things to say about how St. Thomas More has come to the table in the conversations with us. The partnerships that we're developing, because it extends well beyond what we've proposed here today, we are already sending our clinicians over to their emergency department to help staff where they have an individual with mental health or substance use needs, and figuring out what's the plan to get them the supports they need outside of that acute setting. We are in the exploratory phase as far as using the existing sobering center on their campus for the social detox option. Hopefully that works out, but there are a lot of variables on numerous ends. It's not just their decision. There's regulatory and licensure pieces that we still need to address. But they are at the table, and they have absolutely been a part of the conversation. They are a critical partner, just like the primary care community is, just like the criminal justice system is, just like our elected officials are. So I think that, to answer your question, yeah, they play a really important role, but so do a lot of other systems. And so far, they've definitely been coming to the table and being great partners, from my perspective.
What is the time frame for the detox center to come into Canyon City, and where is the funding coming from?
Why hardballs? Come on. So we sent a tentative timeline, and I really am reluctant to share it because I feel like I should inflate it right now to give myself a buffer.
We inflate our timelines too.
Yeah, that's fine.
It's
Good.
part
All
of the
right.
government
So,
process.
We were hoping that we could get something up and operational within 9 months. A lot of things have to fall into place to make that possible. The hardest part for me is figuring out startup capital for the facility. And so again, if we happen to leverage an existing facility and only need to make improvements from a remodeling perspective to make sure that it fits our needs, that's a much lower cost than if that facility doesn't work and we either have to build from scratch or find some other alternative. So there's some unknowns there for sure. I don't know if the legislature this year will be setting aside dollars to help with the expansion of detox services in rural Colorado. There's certainly been a lot of conversation about it, and I've been really active in trying to tell our legislators that it would be very helpful in our communities to stand up those services if we had some resources. Otherwise, I can say one of the big, there's actually two, that we are in conversations with and that have been very supportive of the direction that we're heading in. One is Aspen Point out of Colorado Springs. They're the managed service organization for our region, meaning they manage substance use providers and funding. And we're in conversations with them about how we build out a better continuum of services. So they'll play, hopefully, a role. The other is Health Colorado. They manage Medicaid for the entire 19-county southeast region of Colorado. And they've been an incredibly supportive partner right now in exploring what we can do to set up detox and other levels of care that'll give us a more complete continuum in Canyon City and the rest of the 19-county region. So I'm confident we can put it together, but there's a lot to figure out still.
Sure. Any other questions?
So I know we had some leftover funding from the community agency funding program that we were doing, and we had kind of earmarked some of it for potentially homeless, and I don't know if this would maybe be an appropriate, if they needed help financially to kind of get the ball rolling, if anybody else was comfortable with maybe pledging some of that money that we didn't spend to this program.
What does
Chief's
council have
got
to
money
say?
in his budget.
Go ahead.
I think that if they're to a point where they've got a sound plan in place, where they're seeking financial assistance, it would then be appropriate for the chief and whomever else to bring that information to council, and we go from there. I mean,
So I think that's a great point, and that's really kind of what the purpose of this scope of work is to determine whether or not this is something that has value for our community. This is a grant. It's not going to last forever. And so, long-term goal with this is to evaluate this program and see, does it lower our costs? Does it keep cops back out on the street? Is this a program that's still needed? And then present something to council that if there are funding needs at that point to continue this program, we'll absolutely have a very clear pathway and a specific funding request. But at this point, the state is definitely helping us out with some of our funding. But we absolutely will bring back a solid plan if there are additional funding needs.
I want to reiterate that I think, I hate to say exciting, but the interesting thing from my perspective is that we can address a portion of the homeless issue through this plan. And we all know the complications with that.
Dolly.
I just have one simple question, and you may have clarified this before, but is this just adults, or does this also treat addicted juveniles?
That is a very difficult, so a social detox that would serve both youth and adults
Okay.
is probably not what we're immediately exploring. We'll assess it in the plan, but that creates a whole lot of additional regulatory challenge to overcome.
Okay.
But the point is taken, we need to have the entire age continuum considered in our strategy. On the co-responder side, I think if we're responding out in the community, I would hope, I guess this is a nuance, I'm shooting darts at Chief Harvey here, but that's a service that we certainly have comprehensive mental health and substance use services for both adolescents
Sure.
through and into adulthood. So we would be in a position to want to help there too.
Okay.
So let me do some follow-up with that. And actually, in the handout that I gave you, the youth-based initiatives, that's part of the reason why I referenced that, because the social detox model, genders have to be separated, age groups have to be separated, and so just like in a jail, there's very restrictive who can be in the facility at any one point in time. And my current vision for this program is that leveraging existing programs like Communities That Care and the Collaborative Management Project that are already focused on youth substance use, youth delinquency, minors in possession of alcohol, reduction of vaping and tobacco use, those groups are already in place. And so really what the co-responder group would be is, again, that referral source and discussion points for those existing groups to leverage those strengths, so we're not recreating new systems. But the detox service itself, at least from what I understand in licensure, we wouldn't be able to host that there, but there are enough referral sources for youth who are suffering from or living with an addiction that we could get them the services that they need.
And above and beyond that, so you mentioned we already have several services, and Communities That Care has grant funding as well to help support those services that are already in place. But even farther beyond that, they use a lot of data science on how, instead of just treating kids after they already have an addiction or going to intervention when they look like they're having high-risk behaviors, is addressing what is getting kids to jump into this drug thing in the first place, and let's stop that from happening right in the very beginning.
Right.
And so that's part of that Communities That Care too, that is the ideal, is having our youth make good, healthy choices with their lives to begin with, so we don't have to go through all of these other things. They can grow up to live to their full potential.
And the Communities That Care group, that's actually run by the Department of Public Health with the county, and they have had some recent leadership changes. And one of the young ladies that's part of that leadership group actually grew up in Canyon City, so she went to high school here. She understands the youth. Very energetic individual, and I think is going to make some real positive change as one of the coordinators for Communities That Care. So we're definitely going to get further involved with that to address any youth substance use issues we have.
Any other final questions from City Council? Caitlin?
I think someone had asked what the appropriate follow-up time period would be, but I'm not sure we came to an answer on that.
That's right.
No, no, 6 months, I think. 6 months is
months.
realistic. And
there's still
part of the
an
reason for
initial-
that is we have to not only still get the funding, we have to get the protocols in place. I have model plans and policies, but then we also have to capture that data. And so one of the other things we were talking about just prior to this is how are we going to capture that as an initial call for service? If the police officer doesn't respond, how are we going to share that information as a data exchange if they self-present at the emergency department or directly at Solvista or one of the other mental health providers? So there's a lot of things we have to kind of wrap our heads around to say this is an accurate representation of what we're actually seeing. But 6 months, I think, is a good time frame to say this was our baseline data and here's what we've collected thus far.
Any other final questions?
Yes.
Meisner?
But is 90 days, there's no reportable data available in 90 days?
Maybe. And
It just seems like we need to keep this in front of us for our efforts and your efforts. And I get concerned when we're talking about something being out of everybody's mind for 6 months.
So I think really what the ask would be there is what data are you looking for? Because if you're looking for reportable data that
No.
we have served this many clients, 90 days, we could do that. Have we been effective in this protocol? That takes a little bit longer of an evaluation, but we can absolutely bring back at least some reportable actions within 90 days.
Yeah, I think that in 90 days, they could come back and say, this is what's happened.
Status update.
These are the things we've accomplished.
Absolutely.
These are the new things we have identified as issues, but I just get concerned about shelving it for 6 months. And I hate to use the term shelving, but that can happen real easily.
Well, and I think, Mr. Turner said it best, is that if it's a status update, that's something entirely different than reportable data, in my mind. So 90 days as a status update, absolutely you can do that.
Okay. I'll withdraw the reportable data.
Status update in 90 days, reportable data in 6 months.
Gotcha.
Any other questions? No. I would just like to wrap up and just say a thank you to our community, both to Chief Harvey and Brian Turner. You represent the mental health side with Solvista, but there are a number of agencies in our city that are very passionate for helping those suffering from addictions and drug abuse. And just a couple of weeks ago, we had a community forum on heroin, meth, and opioid abuse. It involved more around the side of having a motivational speaker and the law enforcement, but we also will be having more forums are in the future. And at the last forum, it was a packed room full of not only parents who were devastated with living the nightmare of children with drug abuse problems and children devastated with parents with drug abuse problems, but there were also entities, services, the schools were there. The law enforcement were there, the courts were there, and the community in general that are very concerned about this. And it was a really symbolic of a community coming together. We're a small town, but we have big arms that are wrapping around this issue. And there are more forums coming in the near future. There'll be one in the beginning of March that will do more for families for detection of detecting if you have loved ones that have drug abuse and treatment options. And also on April 11th at DHS, there's going to be a documentary video as well as the science of addiction. And so there's a lot of opportunities for education for our community as well. All right. Well, thank you both very
Thank you.
much. Really appreciate your
Thank you very
time.
much.
Thank you very much.
Thank you very much.
Let's go ahead and invite Ty Cipher, and if you have any folks that you want to join you up at the stand, we'd love to hear from you.
Who put the sour things at our desks here?
It's totally Cindy's our
I-
candy lady.
Test.
What?
It's a test.
Wow.
all meeting is.
It's like you fail.
It really, it tightened my jowls, so to speak. I didn't know what my kids were eating. Is that what it is?
Save those for the next
Yeah, I
council
did. Well, it
meeting.
was laid over and
You
I
thought
stuck
they
one in
were
my mouth and
innocent?
it was sugar coated. It was really great. It was like, whoa, what was that?
You controlled yourself really well.
I did.
You can
yeah.
get drinks like that, too.
Now you tell me. But
They
my
make 'em-
kids eat
they
these
make 'em
all the
even worse than
time.
this. Or better, however you want to.
Sorry, Ty.
Extreme.
I'm digressing. Go ahead.
We needed a pause from that.
You need a break. Laugh a little bit.
Anyway, first of all, I'd like to thank you all for giving me the time to be up here again. Just wanted to give you a brief little update. We have two little projects that we want to have the city be involved with, and wanted to kind of go over everything with you, just to kind of give you an update and give you our vision and show you what we got going on up there. Ashley was kind enough to help me put together a real presentation rather than my high school daughter's poster boards last time. So anyway, the Royal Gorge Ranch and Resort, we are building a world-class climbing area. It's an unbelievable area. We call it the Buckskin Crags. Here's the video of it, and it includes a high line that's going across over 210 feet over to another area. There's a world-class slackliner right there that's come into town just to check it out and do it. It's a big deal. People are going all over the world to do these epic slacklines all over. This is in the heart of the property. Basically, on the farther eastern side, you can see the Buckskin Crags right here. We call this the Buddha Wall. You can actually see the hole that goes right through the wall. You can climb right through it. It's about 5 foot tall, makes for a really, really neat climb. So that slack line's about 210 feet across. This is all on our property right here. We're going to have over 25 or 30 roots in there along the Buddha wall. It's really a special, special little spot. Just down the creek, I call it the creek, but the drainage, the drone will fly down here in a second. That's an area that we call the sweet spot, and the sweet spot is divided by our property line. So what I would propose is, because we're having mountain biking trails come in and out of my property and your property to access some certain areas, that the sweet spot, we can develop a little bit more and have some climbing areas in the section down here. So flying down, so we're right over the Buddha wall right here. The sweet spot is right here. And it's just a really magical spot where there's an opening right in the valley. So the property line is right about right here. Okay? So part of that's on yours, part of it's on mine. And what I'd like to request is that we could work out some sort of lease agreement where I can use it to develop more of the world-class climbing area. You guys can have access through your mountain biking trails that cut in and out of my property. So basically we have a blurred property line that runs just to benefit everybody. All these amenities, there's no charge for them. They'll be open to the public. They'll be open to the members that own a tiny home lot in our facility, or be able to come into off of your main parking lot and your main trails that come right in there. So this is our vision. And I won't read it for you, but it's basically, we're going to allow visitors, residents, amenities to include single track trails, world-class mountain climbing facilities, scenic viewpoints, historic landmarks, and access to businesses up there. So the three elements are train trestles, our trails, and our connections. I don't know, how many of you were had been on the scenic railway train before? A handful of you. Do most of you remember the Point Alta Vista out there?
Yes.
On the far end? So we have a nice video of that coming up too. But so the trail system, Steve is working on some great trails that will cut in and out of our property coming up to Point Alta Vista. My vision is to have the old scenic train track itself become a handicap accessible hiking and biking trail that will do the entire 3-mile loop. Open to the public again, open to everybody. The problem is the trestles. There's 7 trestles out there. I'm already decking 2 of them. This is a great photo, but there's the typical trestle. This is the one that I'm decking right now. This is the 3rd trestle on the property. Can you go ahead and run that video there? This is a good one to kind of give you the overview. The drone flies the entire flight, so you can kind of get a feel for where the train trestle goes out to, the Point Alta Vista. So it was originally a 3-mile loop, and it started right at the big red building, went all the way out to Point Alta Vista. Point Alta Vista is on your property. Your 5,000 acres backs up to my 805 acres. And so there was always just a lease agreement with the train company to be able to operate out there. So you can see this is the old train on the left. So the bed was already there. We've graded it to where it's, again, handicap accessible. The goal is, my nephew Luke has arm walkers and has a recumbent bike, and I want him to be able to ride all the way out there. So here's the first deck that we decked. And they really turn out beautiful. We got a really amazing carpenter out there. Local girl, Ashley McDermott, her company is in Castle Rock now that's doing it. So again, then we sweep around this next train trestle. The track will go underneath it and just ride right alongside it, just because it's a double one where the train was on both sides. It's just too big. So it comes around, and this was the other one right here. So that's the one they're working on right now. They're almost completed with that one. And it's a work of art when he's done with it. It really looks nice. So it continues on, and we have about another half-mile stretch on the dirt again, and then we get to the property line. So the city property, my property line is right there, right next to the trestle. So this first one is a double trestle. It's way too big and too long to be able to deck, so we're going to go underneath that, deck this one on the left that connects all the way to Point Alta Vista, and then this one, that one right there, this rounded one, would need to be decked as well in order to be able to get in and around there. Seriously, make it a world-class destination to be able to ride your mountain bike all the way out there, or hike, or get in and around everywhere. But really, like I say, great craftsmanship, really sturdy, really nice. My two trestles both had railing on them, not specifically to code or anything, but they're old railroads, actual rails that they welded in. The proposal from the company out of Castle Rock is $68,000 to be able to deck both of your trestles on either side of Point Alta Vista, and that includes brand new railing on both sides. Because you can't see, but the railing that you have on there now, well, now you can see it, it's just old sheep fence. So it all needs to be taken off and put in real sturdy. But really a neat structure. This double one, again, both double ones didn't have any bid or anything to deck those yet, just because of the vast size of them. I have over 330 foot, like I say, already decked, and then the first one going into the Point Alta Vista on this left side here is 400 feet, and then the following, the rounded one, the really pretty one, is 210 feet. So pretty special spot. If you haven't been out there in a while, it's pretty cool. It's dangerous to get to right now just because you have to, there is no deck. So great views. Again, this is the rounded one. This will be the most special part of the whole thing. Beautiful rock outcroppings, beautiful vistas. You can see the bridge in the background. Like I say, that's once you get it all cleaned up and decked, it's gonna be pretty special. So that's Point Alta Vista. That's where you're gonna see the hashtag My Canyon City all over the internet everywhere. So I don't know any mountain biking trail where you can have a ride out to such a special spot in such a unique area, and be able to do it in a wheelchair too if you wanted to. So that's we're kind of excited about that. Here's a good map of the trails that come in. The purple line is our property line. You can see the trails have to jog in and out in a couple spots just because of the sheer vast cliffs, rock outcroppings, and things like that. So Steve is a magician making the trails. I don't know if you guys ever met Steve.
Oh, yeah.
You should.
Hi, Steve.
You should meet him. He's the artist out there that's making it all happen. We like to say, basically, the people at FAR and the city have handed him a beautiful canvas, and he's making a masterpiece out of it. So it's really special. If you haven't been able to go hiking or mountain biking on any of the trails, it really is something special. And this will be literally the cherry on the top and make it a world-class destination. So. Like I say, to have a blurred property line is kind of what's needed to make all this happen, and $68,000 to deck those two trestles. You have any questions so far?
I have a question. Are you looking for financial assistance for the decking or just simply access?
I'm looking for the city to pay for the decking of the two
Okay.
trestles on your property.
Okay.
I've paid for my two trestles. So they're already almost completed and stained. And then my contractor is already out there. Like I say, it's Ashley McDermott. I don't know if any of you knew the McDermotts from here in town years ago, but she has started a company in Castle Rock, and that's who our kids played soccer together, and that's how I knew her. And so she came down, and her husband is doing all the work, and just great. They're on site, they're ready to go. So it's be a pretty simple transition to get it done. Steve was working on the trail, the other mountain biking trail that will connect it to our trail that would be the handicap accessible. But again, all open to the public. No, there's no fees, there's no anything. It's just going to be a neat area. Yes?
Caitlin?
What do you anticipate the maintenance being on the trestles once they're decked?
I'm not positive, but I'd say, he's going through and rechecking everything, retightening everything, fixing everything. So I'd say, we definitely need a yearly, the city crew to go out yearly and just kind of inspect and, just check all the bolts and everything probably. But I wouldn't, like say, it held a 2-ton train and 50 people at a time, so told a few mountain bikers they're in pretty decent shape. I mean, they're big, nice structures though.
Okay.
And Point Alta Vista is in fabulous shape. It's all metal. The only wood on it is underneath, are basically just the trusses, and they're totally covered with a metal roof. So, like I say, amazing shape that place is.
Okay, just go down the line. Jim?
Mine's a two-part question. The first one's maybe more for Ashley. What, from your experience with what you're with your group, this sounds idiotic, but what's the value you place there, and also realizing that chunk of change is coming out of our trails. So where does that set with you or your group?
Can you turn your mic on? Sorry.
Push? Oh, hello. So obviously, we have a number of FAR members here tonight to express our support for this project. I think Ty wants to talk a little bit about the Royal Gorge Ranch and Resort, but we do have some slides later that indicate that FAR is in full support of this project for two reasons. The first is, of course, we have been financially assisting with the trails that lead out to this point. So the trails that will access from what we're calling the Quartz Bridge or the Maze Dreamweaver trailhead at this point, at some point will, and it already has, Steve, started moving that way? It already has started moving west, so the trails that will access this point, we're already ready to go. We're moving forward with those. If you're asking yourself if the views from where we were biking on these photos is as incredible as it looks, 10,000-fold. It is an incredible point. I, for one, was here when the train used to ride that route, and it's sorely missed. And this will be literally a method for us to turn that from a paid attraction to a free public amenity. And that point, we lost Buckskin Joe Town. I think that was a loss for our community. So having this back for folks to access, especially from a free standpoint, I think is a tremendous asset to our community. Obviously, we feel that more folks who visit us from outside the area, if they're going to come up and shop at the shops up near Ty's property, shop at all the restaurants and shops up on the 8 Mile Hill area, that's going to help all of us with our sales tax revenue, with our heads and beds revenue, our hotel lodging revenue, and hopefully from FAR's standpoint will contribute to our 1% for trails revenue. So at some point, I don't know if financially the figures would specifically work out, but this will essentially, I hope, sort of pay for itself as we generate more income from visitors coming down. This, as Ty said, is going to be world-class. I don't think maybe there's one other location in the state of Colorado where you can ride a historic train trestle. So that draw in and of itself is going to be tremendous.
Just quick correction. Keep in mind that the 8 Mile Hill area is not
City
generating
sales tax.
tax.
Yes. But as we've talked about before, any amenities that we can add to individuals' experiences here in Canyon City keeps them here longer. If we have a great facility up at the hill, and then we have great facilities down in town, they're going to add those to their list of itinerary items and hopefully stay longer and generate sales tax here in town. Thank you for that point.
Theoretical.
Theoretical, yes. Do you have any questions?
Just an observation, and a statement, I guess. For the city to go forward, liability will be a big issue with us, and how we resolve that. That'll involve discussions, I think, with our attorneys and things like that. But just an observation, I would say that if this is going to be open to the public, just from your perspective, I would want to make it kind of idiot-proof on those trestles, so that if somebody got crossways, took a tumble, that there was no opportunity for them to go out underneath the rail or something like that.
That's a good
Just an
point.
observation.
Mayor?
Oh, sure, you want an idiot-proof. When you talked about those double track, I'm not quite understanding, you're going underneath, you're not going to deck the double track ones.
Right, they're massive. I would
Okay.
have to brought to you, literally a $200,000 estimate to deck them. They're twice as wide. Those are 12-foot wide, and that one is over 600 foot long. So I say the bid would have been, like say, $250,000. So those, we can certainly have the mountain bike trail go underneath it. It's just as magical to ride underneath it and look up at one as it is to ride up on top. Since there is 7 of them, you'd be riding over the top of 4 of them. So I kind of figured that was better than none of them. The 2 at Point Alta Vista, the reason they're critical is because you can't access Point Alta Vista without fixing those 2. Every one of mine I could have just ridden under. Every one of them I could have just stayed on the road and, said that was a handicap accessible trail, but that's not what we're looking for. Again, we're looking for world class. We're looking for classy. We're looking to be able to, the train's gone. Like Ashley said, Buckskin Joe's gone, the train is gone, but what we want to do is keep that, hey, this is where that train rode. And when I was a little kid, we rode right here, and now we're mountain biking on this same area. So I think that's the special part that I'm trying to keep, so.
When I'm in favor of it, just tell you right outright. When I heard of it, it, to me, is like, we have to agree one thing, if they're accessible, someone's going to go on it, and I think we need to make it right. They go on it and it's in disrepair, someone's getting hurt, and we do have a problem. I don't know how you're going to stop them unless you tear it down, and we're not going to do that. I'm flat in favor of it. I really am. So there you go.
Okay, so we're going to go down the line, so Amanda.
Well, I don't want to interrupt because I already told son, I've got a
you have
6
to
o'clock
leave, that's right.
engagement. Okay, so if we can work through all the hurdles with regards to liability and all this other stuff, and if there's a way in there, we're looking at finances, I think this is a terrific project that benefits not just the town of Canyon City, it benefits the tourists and people that come to our area to see what we have. Because what will they do? They'll go back and tell people where they came from, just like the people that go to the Royal Gorge. They go back and tell their friends, and we get more people coming. And that'll just increase everything for everybody. Like I say, if we can work through all the hurdles, I'm 110% for it. And like I said, I'm sorry I have to leave, but I had told you.
Thank you, Frank. Thank you for that. And I think you're absolutely right about that.
All right, Amanda?
Does the $68,000 bid include the railings, or is that just decking?
Yes. For both of the 2 on the city property are brand-new railings, all the stain, everything. The bid was $75,000. Me and my guys are going to do all the cleanup work, all the hauling of all the material in, all of the, what else did I have to do? There was something else. I had 3 things that I was responsible for that knocked off $7,000, so.
And then the railings are just, a little bit of a concern. And so I'm wondering if you, what was the reasoning behind the height that you chose? Is there any studies that have been done to show?
They're all the code.
Okay.
It's just all regular coded railing, just for a regular deck.
Okay.
So they're actually made with the welded wire, the 4-by-8-foot sheets of welded wire, and then they're going to be wrapped in the treated lumber and stained. So they'll have a really nice look without feel like you're, it's going to feel open, but it's not. So they're all to code. It's like I say, it's all
And all to what code?
just the building code for decks. So I
just-
believe it's 42 or 48 inches tall.
But if you're on a bike,
Like I say, they're hiking trails. So I mean, hiking or mountain biking trails. If we, wanted to make them, an 8-foot chain link fence, I mean, I guess we.
well,
could-
I'm not suggesting that, but
Right,
if it's only 48 inches and you're elevated on your bike, however many inches that is, I just am concerned that there could be
We spoke of that
safety
too,
issues.
and then, then there's mountain bike trails where we're on the rim of the Royal Gorge, and it's like 1,000-foot cliff death with no railing. So These are,
City property and.
they're,
The trails are also on city property. The Canyon Rim Trail, you could fall, well, let's
We don't
not
like some-
manifest
we
it, but,
won't
yeah, most of the trails that are on city property at this point run along the rim of the gorge, and you do run that risk, absolutely.
this will be the safest section of any mountain biking trail that's out there.
Dolly?
Oh, I'm really excited about this. I think this is phenomenal. It'll be so much fun if we can get it up and going. My question is it one way?
No, it's a loop.
It's a
So
loop.
it's a one-way loop, so just like the train did.
Okay,
The train had a
so-
3-mile loop from the red building that went all the way out and then looped around. So Steve is making other trails that'll cut in and out. There's a really, really nice set of slick rock out there, so some of it'll cut over there. Mine for the handicap accessible, most likely, unless, we can make another trail bigger, you'll have to come back the same route.
Okay. And then my other question is what happens if the city decides they don't want to invest in this?
Then that's your decision.
No, what happens to the rest of the trail?
Well, I mean, it's not on my property, so my trail will stop at the end of my property, and I'll turn around there. So
Okay.
it wouldn't be, Preston made the point earlier, I mean, I don't want to reiterate it, but people are going to go on these trestles. I mean, they're, as soon as it opens up, they're going to be on it. So I don't know. I wish I had a better answer. I don't know.
Well, no,
So-
I'm just saying the what if there are people that are not in support of this.
Right.
And then my other question is kind of back to the climbing cable?
Uh-huh. The
Is that-
slack lines?
Yeah, is that up there for, like, is it,
Open to the public, yeah. So, I mean, you could, if you have the gear, it's no different than climbing at the city park in Colorado Springs. You can go climb at all the Garden of Gods rocks. Up in Fort Collins, there's, 100 different routes you can climb up there. The slack lines are extreme.
yeah, it looks pretty extreme.
I like extreme stuff, so it's world-class stuff that people want to do. There'll be a Via Ferrata on the Buddha Wall. As you know, the Royal Gorge, you guys are putting in a Via Ferrata up there. Ours will be a lot smaller scale, but you can bring your own gear. You can clip and unclip and work your way across up the Buddha Wall and through the Buddha Hole. So.
And that kind of kicks back to what you were saying, Ashley, about people coming and having larger itineraries,
Can you run the
hiking,
video
biking.
of the Buddha Wall and then the new slackline addition animation?
So you see the slack line's already there installed for anybody to use?
Pardon me, I'm sorry?
The slack line's already there for anybody to use, or do people need to bring their own slack lines?
That one was just our test one. No, the slackline will definitely be there with the safety cable, everything.
Okay.
Is there any sort of
So
permitting
look out.
to use
That's
that?
the actual hole that goes through the Buddha Wall.
Yeah, that's cool. Keyhole.
And for those who don't know,
Long's Peak.
the City of Canyon City also has some climbing areas that already exist here in Canyon City. So Ty's not proposing anything like, oh my gosh, climbing. It already exists around the city and is very popular. So in the interest of spreading out your users, so we're not concentrating so many users in certain parks, this is an excellent opportunity for us to offer an additional option for those folks and really start spreading people out so we minimize impacts in certain areas.
And would you allow climbing on the Buddha Wall?
Oh, yeah.
Yeah,
Yeah, no, I have 25 routes there already.
Encourage it.
nice.
Yeah, no,
Meisner?
this is how we keep those kids off opioids.
That's right. I love it.
Natural
circle.
highs.
That's why my kid's a climber.
Just keep in mind, maybe from a macro view, that the city currently has 2 trestles or 3 on our property.
The city has 4.
4? That years ago, we were faced with a dilemma that those needed to be removed because of the potential hazard of them being there. And if I recall, the cost to remove them is not $65,000. And I'm not necessarily in support of spending that much money for more trails, but keep in mind that those trestles, which I and my dog have been on, they're there now. And you could go out there this weekend if you could get to them, and fall off on one today, and then we have a liability issue potentially because they're there. But we talked about removing them, and I don't remember what the estimate was, but it was.
I'm sure it'd be significant. There's a lot of lumber.
So
To remove them would be a big shame.
I have a couple of questions. You said that the price is reduced because you were going to do some of the cleanup and other things. Are you also doing that same cleanup for the trestles that are on city property as well?
That's what I was talking about, I'm sorry.
Yeah.
So mine, I've already paid to do my 2 trestles, and they're getting stained right now. The initial bid came in at, the initial bid was ridiculous. We talked about doing some fancy metal gauged railing, and it was just like, oh my goodness, I wouldn't even have brought it to you. And then it came back at 78 grand, and I was like, holy cow, that's a lot of money. What can I do? What can me and my guys do? We're right there with our skid loaders. We're right there. What can I do to reduce the bid? And so then we just came up with the things that I could help with. So
So I mean, you're offering about $10,000 worth of in-kind services towards
just,
the
no,
restoration.
7 grand, but I mean,
Yeah.
I didn't even want to bring that up, but I'm just saying it's $75,000 worth of work
75.
that you guys are going to get for 68 grand.
Was there any type of engineering studies done on the trestles themselves to ensure that their integrity still is intact?
I looked for all the engineering reports from when the train was last run, and I couldn't find those yet, but they did pass all the certifications the last time it ran. I mean, through the lease of the city, I'll bet you if you pull up all the paperwork from, because obviously you had a lease with the train, I'm sure that you had all the insurance requirements and all the engineering that went into it, so.
And is this something that would need to come out of our budget this year?
Yes.
Or looking? And so my question to you is, can we find that much money out of our budget? We've already approved our budget.
Well, not from the budget, but from your operating reserves, you have in excess of what your council policy threshold is, so $68,000 won't put much of a dent into over $3 million.
Is that also considering the other issue with the COPs, which I didn't say?
COPs, as you decided, are not coming out of the operating reserves. We're going to generate those savings over the next 3 to 5 years through the general fund.
All right. Any other comments from council?
Just on your point, you bring up a valid point about the engineering. We've hired engineers in the past to look at our pedestrian bridges and bridges. It would be a good thing to retain them to check this bridge out and also address the issue. I don't disagree with you. I've talked to Ty about this. It's a great opportunity, but safety has to be paramount, and especially are we ADA compliant to the letter of the law? So there's issues not just with the railing, but the grading and the surface that they actually have to be on. So we'd have to make sure that we're abiding by the law in all respects. But we think it's a great opportunity.
Amanda?
That's really my concern is I'm all for doing it. I just want to make sure that if we're putting money into this, we're doing it correctly and not something that we'll have to go back and fix later and,
But at the end of the day, Jim's right. Whatever you invest in this, it will pale in comparison to taking it down, because the mayor raises a valid point. If you don't take it down, you still have an attractive nuisance. There's still going to be risk out there which you're not effectively managing.
And it is, Point Alta Vista is absolutely stunning, and I really do feel like we need to make this open to the public. I think that is a huge draw to our community. I love a place that's a destination, and it also has some historical value as well. But I think maybe before we commit to the $68,000 this year, we may want to look at those engineering studies and make sure that we, make sure that we really have our eyes wide open going into this for the big picture of the true cost. Mayor?
Do you have insurance?
Of course.
Yeah. Do you have a problem? Did they have a problem with this?
It's just of course not. It's part of like I say, it's a mountain bike trail, so.
Yeah.
Again, it held a 2-ton train and 30 people just 6 years ago. So, I mean, it's in decent shape. Now, does it look brand new? No. I mean, does it look like a pedestrian bridge? Absolutely not. But, I mean, it's it's a sound structure for people to ride their mountain bikes over. There's no doubt about it, so.
I don't mean to sound like a smart aleck, but I've walked to some of those trails, and believe me, there's a lot more danger out there. And I'm clumsy. And I'm like, oh my goodness, than there's going to be on this trestle.
Yeah.
There really are. And maybe we should look at that instead of this trestle.
Sorry, Mr. Mayor, I did not mean that idiot-proof as a personal comment.
Well, I took it personally. My wife has assured me of that. But yeah, and they're gorgeous. They're just outstanding out there.
It's
and
fabulous.
It's
like I say,
exciting.
it's
But we-
world-class. It's going to put
Yeah.
the FAR even more on the map than they already are, and you guys for the city. Our goal was to have it open by 4th of July, so we would need to have this,
Going.
you know, we'd need the go-ahead sooner than later for the contractor to be able to put in a schedule and get him going. Like I say, he's already on site, he's ready to go. It's a,
I would suggest
Tony.
perhaps, Ty brings up a valid point, the economy of scale of already having the contract, that will save us money. To proceed with that, we'll bring you something for your February 18th meeting to authorize that, and then we can follow up. There may be additional related costs here, engineering analysis, maybe future upgrades to the facility that we can identify over the next couple of months. And so just to be aware that this is the initial investment. It may cost more to upgrade the facility to meet a number of requirements, and we'll bring that back to you as soon as we get that information.
and
I
again,
think
I
we should
should,
take advantage of the fact you got a contractor out there. It will cost us more money to bring someone out there just for these two trestles when he's already out there.
and ideally, eventually, if all of them got decked and refurbished, I mean, it would be absolutely amazing,
I
But-
like the idea of both, going under and over.
And that's what I was thinking. I mean, literally for the cost, and but if all of them were decked, it would be it'd be really special, because the big ones are, but they're just so, like I say, it's just massive amounts of wood. So
So can I ask council, I guess we need to give direction. Are we wanting to move forward with the $68,000 commitment to redoing the decks?
Tony, where are you anticipating this coming from reserves?
The
Where are we
general
at-
fund.
Where are we at with current 19 trail budgets? What's in there, roughly?
Well, that's already been committed to build the trails
No,
that
it's not.
Steve's actually working on, so we're not going to, we don't have sufficient funds to cover this cost. That's less than that. But again, you have the latitude within the general fund operating reserves to pay for this and not make a dent.
We have the latitude also to reduce the trail budget by some amount.
But
Well, the
that'd be
trails have to connect.
self-defeating. I mean, you're trying to create a world-class trail system out there. Why would you reduce your trails to create a structure that people couldn't access? Because exactly where he is right now in his trail building is to access this area.
Steve, can you give us an update of where the trails are at and what the future is looking for this year for the trails? If you don't mind coming to the microphone, we'd appreciate that. And by the way, your trails really are fabulous. We're really lucky to have you create that piece of artwork at the Royal Gorge Park. That's amazing. And also for the other work that you've done throughout town. Thank you so much. We love it.
Thank you. The Made in the Shade is what we are calling it right now. I just completed that, 2 months ago, I guess it's been. The design is completed to drop down from Made in the Shade to connect to Point Alta Vista. And I have already started that connection. So without building the trail I'm working on now, there is no connection from the
Okay.
city property. Yes.
As long as that trail
Yeah.
is a connecting piece,
Yes. It's the missing
I'll
link.
buy that. But if
Yes.
it's not a
It's the- no,
connecting
it's the
piece,
missing
then
link.
those revenues
Yeah.
need to get directed towards the 65, in my opinion.
No,
Yes, the only other way to get there would be to go through Ty's property. From the city property, you cannot access that at this time.
Yeah, I might want to suggest, and we can coordinate in the calendar, we should take a field trip out there so you can see firsthand the work he's done, especially the latest trails. I mean, they truly are world-class. I mean, the recent trail he just completed was a 3-mile loop that is gorgeous, both from a visual, aesthetic standpoint, but also the contour of the trail, its accessibility. what he's able to do, which is unique, is he builds trails that both a beginner, whether it's a mountain biker, hiker, could utilize, but also an expert. It's just a question of how fast you want to be on, but they're all doable. That's what makes them so unique. Because most mountain bike areas, like whether it's Moab, they're really for experts, or someone that has a strong background. These trails are for everybody, and that's what makes them so unique.
So I think, Councilman Meisner, you've brought this up before. At some point, we're going to have to transition from building more trails to just maintaining the ones that we have. At what point do we reach that? Do you see that being the right?
Well, as far as what's proposed at the gorge, there is probably another, I'd say, 5 miles beyond what I'm working on right now. But I wouldn't think there's anything more than that. And I do agree that as it is, there's a fair amount of trail between the Royal Gorge, South Canyon, Oil Well Flats, and maintenance is important, very much so.
Am I not correct in terms of the fact that we currently do not have the budget funds to maintain all the trails in our current system?
Well, we do maintenance on them.
I did say that. But if we have
for example,
major damage to those trails, we are not going to be able to fix them immediately.
That's not true. We've already had major damage on these trails from the storms last July and since then. Hogbacks is an example. Rex's crew has addressed that. Steve's addressed a lot of the trails up in the Royal Gorge, in addition to Dawson Ranch. They all suffered heavy damage, and that was all within the budget.
Okay, and corrected?
Yeah, yes.
And Ashley,
They're all in good shape.
What role does the FAR funds kick into the trail building and maintenance?
Great question. So at this point, we have our 1% for Trails program continuing in 2019. Essentially, what we offer is supplemental support. So, for example, Steve needed a particular piece of equipment, and he came to FAR and asked for the money to buy that. It's a rock basher of some sort. A rock cutter, something. Anyway, it's expensive, and he got it on sale, so we're pretty excited. So we purchased that for him. So we allocate funds also for a supplemental trail builder. We also have a gentleman named Rob who has been working on the trails, and we have paid for him to come and assist Steve in the building of some trails. So we are offering financial support. We do some stewardship as well, and we're open to creative ideas to help the community help maintain the trails as well. As you know, FAR is growing incrementally as the years go by, and so we're looking into some options for offering stewardship programs for local community groups to help us maintain those trails free of charge, so that when something does happen, we can mobilize those groups to help us maintain the trails, whether it's anything from brush clearing to raking rocks, things of that nature, to leave Steve to the more technical maintenance. So we are looking into that, and we would love to help with that, help Rex and his folks down there.
On February 28th, we're going to have our big house follow-up meeting with the local wardens. One of the 3 things on their list is providing us labor services, and our number 1 priority would be to utilize those offenders for trail maintenance, which they have a history of doing quite successfully in the past. So that's going to be a great resource, because your concerns are very valid. We're going to have a great network of trails. We've constructed them. Now we have to make sure they're rideable, walkable, and properly maintained, because they are subject to the weather conditions here, and they can quickly get eroded and damaged, and we need to get out there and fix them as quickly as possible so they're
All right,
safe.
so let's ask council, do you want to proceed forward with the 68,000? So Dolly's a thumbs up. Amanda, yes? Mayor?
Absolutely.
Jim?
Yes.
Caitlin?
I'm a yes, but if I could just make one comment. We've been talking a lot as a council, spending money in real estate, great amount of dollars on real estate, and for plans that are going to take us a long time to come to fruition. But this is a plan that we could have in place and be providing something really fantastic for our community within the next 6 months, and I find it really exciting.
True.
That's true. Trails are a really affordable way to have a lot of great economic development and entertainment for our town to have things to do.
Thank you very much for that. Like I say, none of it's going to me. I'm not making any money on it. There's no reason I want it other to make it really, really cool. So but thank you for that. Like I say, it's, once you get to take your grandkids and your kids out there, you're going to be like, holy cow, this is really special, you know, so we're excited, so.
I guess the next question is how we're going to market it.
Yeah. No, I don't think it's going to need much marketing. I just want to say thank you for bringing a vision to fruition, because I think this is really going to open some things wide up for us.
Thank you. Like I say,
So-
me and my brothers, we grew up here, we all graduated high school here, and every year, we'd take my littlest brother, Todd, out for his birthday to ride the train. And it was always a cool deal, and we'd go to Buckskin Joe. And so now, instead of that, I told him, hey, now for your birthday, we're going to go out there and we're going to ride our mountain bikes on the same trail we did when we were little kids. So
Can relive it. That's
exactly.
awesome.
That's what's cool to me, and I'm excited about that. So anyway, quick update. Don't want to bore you, don't want to take too much of your time. Again, appreciate it. So property, 805 acres. The goal and the vision is to have the vast majority, not the vast majority, the majority of the property be an open space. So 43% of the property will be all left as open space. The wetland areas, the amazing amphitheater, the amazing climbing area, and of course, all of the trails for the mountain biking. Can you go back to that real quick? 42% of it will be 1 acre tiny mansion lots. That'll be 339 exceptional and unique lots. We've started to identify all those. I have a little map here that kind of shows you. We have roads cut in and just identifying A-plus lots where we have either the little stream coming through or we have epic views of the Point Alta Vista, the Sangre de Cristo mountain range. There's basically 5 different little ecosystems there that all make this property really special. So 15% of it will be marketplace. Again, eventual winery, brewery, tap house, mountain sports type of feel store, convenience store, liquor store. We need some facilities up there. As we know, there's nothing there. To your point of not being in the city limits, I hope at some point you guys can acquire that property that will make you be able to touch all of our properties up there, and all of us will certainly allow you to annex us, okay? Bring us water, bring us a sewer system, and we will join your city open arms, okay? We'll pay any sales tax you want if you just brought us facilities. We should have done it years ago.
Well, it would have to be high to pay if they want us to pay to get the sewer
Water's only
system.
20 million, so.
Right. We need a new water station coming out of Parkdale area. I'll say it again, you know, that's where the future of the water from Canyon City needs to come out of. It needs to come out of Parkdale at the bottom of the hill, pump back up, have another water station up there that all ties in. Anyway,
Well,
way
it's
off
like
base, sorry.
send your business down to Canyon City too.
Pardon?
Said we'd love for you to send your business down to Canyon City too.
Absolutely, yep. And like I say, we're honored to be a part of it. So the 1 acre lots, electric, individual water cisterns, storage tanks, and then septic systems. The lots will be about 100 grand. The tiny mansions will be about 100 grand as well. So what we're saying, okay, here's a good map of the whole property. This is 3A that comes in. You can see the rounded red line there. W's are the fire tanks, suppression tanks that will be required by the fire department. There'll be 5 of those on site, all about 15 to 20,000 gallons. They have to be all up to code to be able to suck out so much water per second to be able to put it all. You can see all the roads that we've cut in. A lot of these were old ranch roads. A lot of these were old mining roads. So we kind of have reclaimed all kinds of stuff, and then we're cutting in obviously new roads to get to these amazing areas. The entire bottom part of that map is all you. So your property starts right here, and BLM's right here, Mrs. Johnson's right here, and I'm right here. So we're neighbors on the entire south end. This is the property line that we need to have some sort of lease agreement where it can be blurred. I told Farr and Steve, you know, you guys can have your mountain biking trails come in and out of my property wherever you want. It doesn't, to me, it doesn't matter, because I'm going to have mountain biking trails that come in through here for everybody to be able to ride as well. The vision is a recreational retreat where you come and you just enjoy nature, you enjoy the wetlands, you enjoy mountain biking, you enjoy the climbing area. It's just all about being outside and just soaking it in. So the tiny homes are.
Okay, we have a question from Councilman Meisner.
Can you pop back to that last slide?
Yes.
I just warn everybody that there's a lot of homes and a lot of streets that are being built there, and those streets are kind of being cut in to maintain that mountainistic view. And we are having current discussions now with another development that the roads were not necessarily, and the drainage was not necessarily done to city code. And now the city has taken the blame for that. So we need to keep that in mind. I realize this isn't a city project, but if we're talking about future annexation, that becomes an issue.
Gotcha. I have a real good surveyor, Matt Cook, who is helping do all that. I have a real good drainage study being created right now. We're making everything, as first class as possible. We're not cutting any corners here. This is going to be a first class resort. Now, if a 200-year flood comes again next year, we saw it. I mean, your roads can't handle it, my roads can't handle it. It doesn't matter. 200-year flood comes in, we're all just like Dawson. I can't handle that, but I can handle a 50-year flood. So anyway.
I actually, Mike Bandera, if you don't mind, I'd like to ask if you have any opinion as a representative of the Royal Gorge Bridge on your feelings on these future developments, particularly for Alta Vista. Yeah, yeah, for you, Mike.
Oh, yeah, I was talking to Ty earlier. I just didn't want anybody to forget that you have a major asset up there, and being the Royal Gorge Bridge. And probably over the last 18 years, nobody has been out to that viewpoint more times than I have. And that is a beautiful view of the Royal Gorge, a beautiful view of the bridge, and believe me, we will get our share of attendance of those people that file out there on that scenic overlook. And, I'm sure it'll amount to more than what you're going to spend over a number of years, but you'll get your money back just, right off with the Royal Gorge Bridge and Park. And as far as the overall development, and, I can't really speak for the Royal Gorge Bridge right now. I have retired, but Jerry is here and could speak for him, but I know...
Come on up, Jerry.
I know that, as far as the previous general manager, I was very much in favor of this overall development and what it's going to do for that area up there. I've been up there, like I said, for 18 years, and during the winter, it's pretty lonely up there. And this type of development, I think, will help that, and it'll help our attendance at the bridge. And Jerry?
And Mike, before you leave, happy early birthday.
Oh, well, thank you. Yeah, tomorrow is the day. Yeah.
Well, happy birthday and congratulations on your full retirement.
Well, thank you.
I doubt if he'll ever be fully retired.
Yeah, that's
I don't
true.
think that's going to happen. To speak for the Royal Gorge, we're very excited about the project, and just what Ty has done with the fencing makes, in my opinion, makes it look like when you're driving up 3A that there's really something to drive up for. So thank you so much for that. I think it's great. So I think we're all excited about it, and we do think it'll help our attendance.
All
So
right.
it's good.
Okay, thank you.
Thank you. So finalized the deal with a tiny home builder. So these are all park model RVs. Originally, I was going to be partnered up with a company out of Wisconsin named Utopian Villas. They are the leader in luxurious park model homes. The deal didn't work out. Logistically, it didn't make sense. We were going to build a plant here. Didn't make sense. Everything we just couldn't make it work. I partnered up with Sprout Tiny Homes out of Pueblo, Colorado. I was lucky enough to have Ryan introduce me to Rod. Ryan actually helped Tiny Homes get on the map and get set up in La Junta. Sprout Tiny Homes is a publicly traded company now. They're the company that did all the employee housing for the Aspen Ski Company when they had their issues with their employee housing. So anyway, really honored to be partnered up with them. But now we've partnered up, Sprout Tiny Homes has partnered up with Utopian Villas because they have the best designs, the best plans, and the best engineering, and a net zero park model. So these are designed with their solar panels on the roof to be net zero homes. So that's one of the coolest things, and I'm really, really proud for that. So beautiful designs, unique architecture, everything from rooftop decks to side decks, patio decks. There'll be 4 different models with 2 different kind of elevations. So there'll be 4 models, but there might be like 8 different kind of options, like a Denali option and Escalade option is kind of what I'm going at. So top of the line, first class. They're not cheap. They're $100,000 starting, but I keep teasing people. I say, show me where you can own a tiny mansion with an acre in a world-class climbing and mountain biking area in a world-class tourist destination for $200,000. Show me that anywhere and I'll go buy one right now. I mean, it's not out there, so that's where I'm really thinking we're going to get to have a lot of people, middle-class people, be able to afford a second home, a recreational retreat. So, again, it's crazy to think that $200,000 is affordable, but in this day and age, you know, it is, you know. So they're gorgeous, gorgeous, gorgeous floor plans. They're going to be built right in Pueblo, Colorado. They'll be shipped in the middle of the night right up here, and there'll be 300 of them coming through town in the middle of the night in the next few years. So, open space, hiking, biking, world-class climbing. Trails will be accessible to the general public again. Marketplace, sporting goods. We need a really good mountain sports store. We need a really good brewery. We need a really good winery, hard cider place. You know, just a cool vibe. No different than the Whitewater Bar and Grill up there, only on a little bit grander scale. So that's kind of what we're looking for. Project costs, again, $68,000. It was $75,000, but we got it down to $68,000. Thank you to the city for listening to me. I'm an open book, so if you have any questions or anything, you can always let me know what's up. This is the part we should have gone over first, is the benefits. Dang it. So anyway, yeah, they're going to, the Royal 50 that's coming up on September 1st, if we can get the Point Alta Vista open by then, you're going to see a lot of people be really, really happy out there. So it's cool. Free amenity, that's what's cool. Same with the climbing. I don't know how we need to proceed with, you know, if you guys are comfortable with, you know, we kind of drafted a lease to where you guys can have your mountain biking trails come in and out of my property. So I don't know if we just need to add to that to where we can climb on that one part of your rock that's yours, or if you guys are comfortable with that, or how you want to. I don't know what to do next time.
We have a question from Dolly.
I think, I'm not sure who this would go to, but parking. If we're seeing an increase in use of these trails, do we have sufficient parking at our trailheads to accommodate?
For the major trailheads, when you go up to the campgrounds, but we're working with actually the Royal Bridge Company to potentially lease a nice tract of land to park quite a number of cars. Just before you know where the new cattle guard grade, right there.
Okay. I put the map up
So
for
it'd be
you.
a perfect location to
good.
directly access this particular section of the trails.
Okay.
Do you have a grand opening or anything planned?
Shooting for Labor Day.
Maybe.
Shooting for the Royal 50 is our grand opening tiny home, model home tour.
I'd like to go. I'd like to dust off my hat and be there.
You should bring your big black one you wore the other night.
It's the only one he has.
I don't think it's dusty.
What?
Leave the rabbit at home.
No, the rabbit has to go with me. You're lucky. I was looking for a groundhog, but couldn't find any. I don't think anybody out here knows what a groundhog is, so I looked for a prairie dog. I couldn't find one of those, and Shirley said, "Here's a rabbit."
Thank you, Shirley.
And special shout out to Ryan for doing such a great job the other night downtown. It was a lot of fun, and I was honored to be there. So I hope we get the top 5. That would be really cool, huh?
Okay, right.
Awesome. Any final questions from city council or comments?
Any council that hasn't had the opportunity to walk on one of those trestles or under them, and it's like he said, that the experience is almost as good walking under it and realizing where you were at. It's very enjoyable for both levels.
We'll organize a tour. We'll work with Cindy on your schedule, do something in the next couple of weekends to bring you out there, because it really is spectacular.
It's even more challenging to do it without the handrails, for a
Well,
person like me.
I'll challenge you to bring your bike.
And with a dog.
With a dog.
The dog. I got
My dog wouldn't go on the trestles. He was
He did
scared.
it.
My dog just
would
went.
drag me.
Yes.
I was worried about him knocking me off, but he didn't.
It was really scary when there were down trees. There was a bunch of down pinions that had fallen on it, so it was
All right,
really
well,
sketch. It's
awesome.
definitely not sketch now.
Thank you so much for your time and
Thank
your
you.
vision and your cooperative business plan with the city. We certainly appreciate that as well. It's a win-win. And I think we're ready to wrap today up.
Thank
Thanks
you.
for all you here for supporting the trails as well. Okay, we're adjourned.